Welcome, everyone. This is Michelle Jester, the Research Manager at the National Association of Community Health Centers, and I want to thank you for joining us today on our webinar, where we'll be talking about integrating clinical and non-clinical care to address the social determinants of health. So today what we really wanted to do was to give you guys some strategies to first kind of determine whether your organization has capacity to address social determinants of health in-house or through community partnerships. So we'll help you figure out ways to determine what might work best in your own setting. We then wanted to outline some steps that you can take to build partnerships to integrate clinical care and community services. And then finally, what we wanted to do was to provide you with kind of an array of different approaches so that you can kind of compare and contrast different ways to respond to socioeconomic needs, because there's no one-size-fits-all when it comes to responding to social determinants. This is kind of very much a journey for all of us in a new frontier that we're all kind of learning together. And so you might be surprised to figure out that there are lots of things that you can do within your own organization, and then lots of kind of potentially quote-unquote low-hanging fruit that you can do with community-based organizations as well. I also would like to introduce my colleague, Shell Lessington. She is our Prepare Project Specialist here at NAC, and she will be helping to facilitate some of the conversation that may happen during the webinar. So if you have any questions, definitely feel free to put them in the chat or in the Q&A, and we will try to get to as many questions as possible at the end. So even though we're talking about integrating clinical and non-clinical care, for us, this work really all begins with standardized data. So we really believe that standardized data on the social determinants of health is the foundation for integrating clinical and non-clinical care. So once you have standardized data on the social determinants, you can immediately integrate non-clinical aspects into your patient treatment plan at the point of care. So, for example, if you learn that one of your diabetic patients has been feeling socially isolated, you can refer them to group education classes so that you're not only helping to mitigate the clinical outcome of diabetes, but then you're also able to address the non-clinical need of feeling socially isolated, which actually may be contributing to the individual's diabetes or struggles with diabetes management. So at a more organizational level, having standardized data on the social determinant needs of your patient or your client population will help you identify which community partners you should work with to address the non-clinical needs of your patients. And finally, at a larger, more macro level, standardized data on the social determinants of health and non-clinical services will really help inform payment models that reimburse for both clinical and non-clinical services that go into caring for a complex patient population. And really, we're trying to build that evidence base to make this clinical and non-clinical integration more sustainable. So we just kind of really want to emphasize the importance of collecting standardized data on the social determinants of health. And to that end, we just wanted to briefly introduce you to Prepare as a way to collect standardized patient-level data on the social determinants of health. So for those of you who aren't familiar with Prepare, Prepare is a protocol that we at NAC developed in partnership with the Association of Asian Pacific Community Health Organizations and the Oregon Primary Care Association, along with several health centers and health center-controlled networks, to be able to really kind of collect standardized data on the social determinants of health in the electronic health record for actionability purposes. So we built Prepare with providers, clinic staff, and patients in mind. So we really took data burden, we took the sensitivity of the questions, and we took workflow flexibility very seriously when we were developing and testing Prepare in various settings. So Prepare is built into several electronic health records. So we currently have it for eClinicalWorks, Epic, GE Centricity, NextGen, and MediTab. And we are close to having Prepare templates for Greenway Entergy, Greenway Success EHS, and Cerner. And then we are also working on building templates for Athena and Allscripts. We're really hoping to try to reach the vast majority of some of the major electronic health record vendors. And you can find Prepare and the electronic health record templates along with free guiding resources at our website on the screen that you see. So it's nac.org/prepare. But kind of going back to the topic at hand, one of the most frequent questions that we and our early Prepare adopting organizations received from staff was, what do we do if we don't have resources to respond to the needs identified? Some people were feeling pretty uncomfortable collecting this kind of data if they felt that they couldn't do anything about the needs that were identified. And this is a question we take very seriously because we don't want you to just collect data for the sake of collecting data, particularly sensitive data that's on people's lives. But we've learned from our early adopting organizations that you really need to start somewhere, and data collection is that first step. So by collecting data, that will really help your organization figure out what services it can provide in-house. Or maybe your organization has services in-house, but they're just not very well known by your patients or your staff, and so you may have some resources or services in-house that are really kind of underutilized. Collecting this data can also help you as an organization figure out what community partners you should be working with to help address some of these needs. So as long as you frame collecting social determinants data to patients as an opportunity to get to know them better so that you can improve the services that you offer, patients overwhelmingly feel comfortable answering these questions and talking to others about their socioeconomic circumstances. And most patients really appreciate being asked about their life. And so what I hope that after the webinar today, that you will feel more empowered with ideas, with strategies, with tools that you can then utilize or enhance your existing resources at your organization, or be able to build new resources or partnerships with others in your community to be able to address the social determinants of health. So to that end, let's start with some strategies on being able to integrate clinical and non-clinical care. So the first thing that you will want to do when thinking about responding to the social determinants of health is assessing your own organizational setting. And we think it's important to kind of look at three key topic areas when assessing your setting: people, processes, and technology. So for the first one with people, it's important to think about if you have staff time that can be dedicated to social determinants at your organization, so whether it's a clinic or a community-based organization. Do you have specific roles at your organization? For example, a community health worker, an outreach worker, a patient navigator that is focused on addressing a patient's social needs, and do they have the appropriate knowledge and training to be able to respond to a patient's socioeconomic needs? So something to think about. The next key topic area are processes. So do you have referral workflows in place at your organization to be able to connect patients with resources, again, whether in-house or through community partners? Have you formed partnerships with external organizations? So you may have local food banks in your community, you may have an employment agency at your community. Have you really started to form those partnerships with those in your community to be able to then make those referrals? And then finally, it's important to think about the technological capacity at your organization. So does your data system, does your electronic health records support or systematize patient referrals to social services? Are you able to close the loop to see if a patient actually goes to the referral and goes to that service? Are you able to share data with external organizations, so maybe with your community partners? Are you able to share data with them, because often they're on different data systems or they don't have a data system? So are there going to be ways that you can be able to share data about the population that you are both serving to figure out if patients are going to services, and if so, what is working and what is not working? As you assess your setting, you will want to determine what information, resources, and workflows you already may have in place to respond to the social determinants, or figure out ways to determine new workflows and determine what works best in your own setting. So for those of you who were able to join our March webinar that was on workflow models for collecting data on social determinants of health, you notice that we like to use the 5 rights framework to help determine a workflow that would work best in your own setting for data collection. So we've done something similar here where we've applied the 5 rights framework to figuring out what workflow might work best in your own setting to respond to social determinant needs. So for those of you who aren't familiar, the 5 rights framework walks through those key questions of who, what, when, where, and how. And so applying this framework to responding to social determinants, you'll first want to ask what. So the right information. So what information and resources do you have to respond to social determinants data? And is it up to date? So many of you, if you're a community health center, you likely have a community resource guide as part of your patient-centered medical home requirements, and that's great. But is it up to date? So that's something definitely to keep in mind. A lot of times, community-based organizations can pop up. They may not necessarily be on the grid or online, so it's really important when you're updating your community resource guide to really engage your staff, engage your patients in your community, because a lot of times some of these services and organizations are spread around via word of mouth, and so that's really important to kind of really engage your community leaders to figure out what resources people tend to go to. Some of you may have referral lists. So again, kind of just as with community resource guides, it's also important to keep your referral list up to date. And then along with this right information, again, kind of think to yourself, do you have a system in place to be able to track those referrals? That's something we hear a lot from the field, that they're making all these referrals, but they're honestly not sure if their patients are going to those referrals, and so they're not sure if all this work that they're doing is really effective. And they would like to learn more that if patients are not going to the referrals, what's keeping them? What are those barriers that their patients are facing to be able to actually get to the referrals? Because if they are facing barriers, then it might be important to think about, again, what more could you potentially provide in-house or ways to make it more accessible for patients to be able to access those resources. The next question you want to think about is how, or having the right format. So how do you have that information stored, and then how do you use it and present it to patients? So is your community resource guide or your referral list on kind of your organizational intranet such that any staff person can access it and potentially download a list and be able to hand that list to the patient? Is it simply kind of a 3-ring binder that's in certain hallways that people can flip through? How are you handing it to the patient? Are you giving the patient a printed off resource that lists the various services in their area? Is it specific to the needs that that patient's identified with you? So to think about kind of how you have those resources and information stored, and think about what might work best in your own setting, and to have kind of as much of a seamless referral process as possible. The next question to think about is who. So having the right person respond to the social determinants data. Do you want this person to be kind of a dedicated staff person? So do you want only your patient navigators to be responding to social determinants data? Or do you want anyone in your staff to feel empowered and part of the process of being able to respond to a patient's social determinant needs? Do you want the provider to be the one to respond to socially determinant needs? Again, there's no right way or wrong way. There are just trade-offs associated with each, but it's just something for you to think about and consider what would work best in your own setting. The next question to think about is when. So when will the referrals take place? Will the referral take place immediately after the need is identified? Would it take place potentially, let's say if you're assessing socioeconomic needs before the visit with the provider, would you potentially want to respond to the needs after the patient sees the provider so that you don't delay the visit with the provider? Would you want to do this at the very end of the visit? So again, to ensure that you're not delaying the visit with the provider. Again, no right or wrong way, but just something for you to think about. And then finally is where. So where will the referral take place? Is this something that might happen in the hallway as the patient is checking out? Will this happen in a private office, like if a patient navigator has their own office, that you can do it there? Would it occur in the exam room? Again, potentially after a nurse does the vitals, and so then you're able to talk about social determinants, or after the provider does the visit, and then a non-clinical staff can come back into the exam room to kind of talk about prioritizing some of those socioeconomic needs. So some other things to consider, because some people may prefer to have a private place to be able to have these conversations, whereas others may want to more, just as the patient is checking out, have that be part of the process of checking out as well. And kind of the last thing to think about when thinking about strategies is that once you assess your capacity and workflows in your own organization, you'll then want to assess the capacity and resources of your community. So what this matrix shows is kind of a continuum of resource and capacity at both the health center in this case, or your organization if it is not a health center, and then what your community may have. So we have your organization on the vertical y-axis, and we have your local community on the y-axis, horizontal axis. So let's say you're in a situation where both you as your organization and your local community do not have that much capacity or that many resources to be able to respond to social determinants. So you kind of fall in that bottom left quadrant of this matrix. That's where you'll want to focus on really kind of just getting started, raising awareness about social determinants in your community. If you're collecting data on social determinants, this is a great way to start sharing that data with others in your community to kind of say, you know, housing really seems to be a priority or a really big need in our community, and so this is something that we should really kind of discuss to figure out ways we can address this together. We've had instances where health centers that have been using Prepare have been able to share that data with local funders in their area to kind of highlight what needs there that existed in the community, and that really kind of helped guide the work of the local funder. So in this instance, the local funder had already invested a lot in housing in that community, but once a couple of health centers in the area started collecting Prepare data, it emerged that housing was still very much a big need in the community despite the investment already made. And so the health centers are really able to take that data to the local funders and really advocate for more investment in housing because there still was a great need. Let's say if you are in that top left quadrant, so you as your organization have a lot of resources and capacity, but your community doesn't, this is where you want to focus on what can you do in-house, and then, you know, refer to some organizations that may have more capacity than others, but you'll want to really kind of focus on what you can really do in-house since you guys are the ones that do potentially have more capacity. If you're in a situation where your organization may not have many resources or capacity to address social determinant, but your community does, focus on those partnerships. Use that data to identify who are those key partners that you should be working with, and really start kind of figuring out systems that would work in place because you guys would be serving the same community, and so figuring out what would work best for the both of you. But definitely utilize those resources that exist in your community. You don't want to recreate the wheel, especially if the wheel's already running very smoothly. So what can you do to really kind of leverage and add value to work that your community partners are already doing? And then finally, if you find yourself in the fortunate situation where both you as an organization and your community have high resources and high capacity, this is where you really want to focus on those coalitions, those strong partnerships, and really kind of even doing more advocacy around the importance of investing in social determinants in your community. You know, being able to kind of demonstrate that evidence of interventions that are working really well, demonstrating the impact and kind of the return on investment, if you will, of being able to do this work. So kind of think about where you and then your community kind of falls, and that might help guide your work together. So when we're talking about community partnerships, there are some key steps when building community partnerships, and I'm going to kind of walk through these briefly each. But one thing that it's important to keep in mind is that a key ingredient in all of this is time. I know social determinant needs are of the essence right now, and I'm going to try to highlight some ways that you can do things quickly to be able to address needs, but to develop really kind of strong, lasting relationships and partnerships, it does just take time. So something to keep in mind, and again, this is something that we're all kind of like on the forefront of really doing this together. I mean, we've been doing this kind of separately for a long time, but really to kind of have really integrated clinical and non-clinical care systems, you know, this is something that we're all working on and learning together. So the first step is really to kind of identify who those key partners should be that you work with, and there's some different ways that you can do this. I've alluded to the first one before with starting with the data. So once you start having some population level data on the standardized social determinant of health needs of your population, use that as a guide. So if you find that food insecurity, transportation, and housing are the three major needs of your population, kind of target those community-based organizations that are focusing on that work. because then that way you're starting to prioritize those that the population has kind of let you know there are kind of big issues in the area. Another way you can identify key partners is by identifying strategic opportunities. So you may have some very well-resourced organizations in your community that would be excellent partners, but they just may not necessarily have the access points that your organization has, because maybe they just don't have as many clients coming in and out of their doors as you do as a healthcare organization. So that's an opportunity to potentially identify those that would really benefit by having a referral system with you, and then you would benefit because you'll be working with a very well-resourced and very knowledgeable organization that's focusing on a particular social determinant or many social determinants. And finally, another way that you can really, a strategy that you can use to identify key partners is by using your population segmentation needs to kind of guide your partners. So if you and some other community-based organizations are really kind of focused on the same population, that's a great way to form a partnership because you already have some common agendas and common goals, is that you're really trying to improve the outcomes or improving the care management for a specific population. So that way, you know, that really kind of helps guide your work together. So that's another way you could potentially help identify some partners to work with. Here's just a sample list of partners in your community that you can work with. And please know this is not an exhaustive list, but some examples to kind of help trigger some ideas for you guys. So one of them are community action agencies or community action programs. And if you're not familiar with these are were also created out of the War on Poverty back in the 60s, but they really focus on doing a lot of early education. So they operate a lot of Head Start preschool programs. They operate a lot of food pantries. They do a lot of low-income home energy assistance, so like utility grants. They do a lot of weatherization assistant programs. And some other things as well. So these are really great partners to look up in your community. There are over 1,000 community action agencies throughout the U.S., and so there is likely one in or near your community that these would be great partners because they kind of offer a lot of non-clinical services under one roof. So something to look into. For transportation, it would be great to really start building a relationship with those local and regional transportation authorities, those that kind of determine the bus routes and how many buses and roadways, sidewalks, those kinds of things. We had one health center in Iowa that I think they had a behavioral health integration specialist that was part of the Prepare data collection team, and she kind of took it upon herself to start going to the local transportation authorities meetings, and from that she was able to develop a relationship with them, and with that she was able to negotiate better bulk discount rates for bus tokens and taxi vouchers that the health center could then provide to their patients. But then what the health center did was also kind of geomap data that they got on the transportation needs, and so they were able to highlight those areas in their county that were really experiencing a transportation need, and so they were able to take that data back to the transportation authority and really kind of use that to advocate, be like, okay, we really need new bus routes to these areas because they're experiencing, you know, burdensome transportation issues. So definitely some to keep in mind in your area. There are also a lot of innovative programs that are working with ride-sharing services like Uber, Lyft, where the health center or other organization is able to kind of get discounted rates that patients can then use for Uber and Lyft to get to and from the clinic or to and from other, you know, key non-medical entities like the library, grocery store, YMCA, those kinds of things. Some other partners to consider creating relationships with are the ambulance, fire, EMS services. And this is just good to kind of keep a tab on potentially finding patients who might be using ambulance or EMS services frequently, and then potentially working with them to figure out the reason for the use. Because if it's a transportation issue, then that's something then obviously that you guys can then work on fixing together, which would then hopefully lower healthcare costs and healthcare utilization appropriately as well. In regards to education, I talked about Head Start. But community colleges and local schools are also great opportunities for partnerships in the sense that you could have teachers or professors from community colleges come and teach a computer skills or financial literacy class at your organization, or if you're working with local schools, you could work with them to kind of build community gardens in the schools, and then working to develop like cooking classes or nutrition classes together with the schools, because it's a great way to kind of get the kids outside, learn about where food comes from, and lots of great opportunities there with your local educational institutions in your community. In regards to employment, obviously, you know, there are job training centers that can do a lot on resume building, interviewing skills. There are employment centers and then temp agencies as well that would be good places to potentially refer clients to as well. In regards to economic development, your local chamber of commerce and then local funders, as I kind of alluded to before, are great people to engage in the sense of potentially learning more from them about what businesses they're trying to attract, because if you learn more about that, then again, that can help inform the job training centers on what skills they should be, you know, trying to train the community in, same with the community colleges. Or you can also kind of advocate with the local chamber of commerce to bring in businesses and encourage them to really hire locally, to provide more job opportunities in your community. So some things to think about for that. Law enforcement. So if you're doing some work around community safety or kind of community revitalization, it's great to engage the law enforcement. I know with recent headlines, you know, there's a lot of potential mistrust between law enforcement and communities, so that's definitely something that you want to keep in mind. And again, this is something that will likely take time, but the more that the communities can come together and learn from one another and build those relationships, the better. So food and exercise, obviously I'm sure a lot of you guys know a lot of the partnerships with farmers markets around, so either having farmers markets kind of be hosted at your organization to kind of bring it to a convenient location for patients and clients. And again, then there's opportunities to use SNAP or WIC benefits at farmers markets to help kind of like enhance the amount of money that goes and that's able to be spent. Grocery stores can often do great programs or like grocery shopping classes to kind of educate people about ways to buy healthy on a budget and those kinds of things. Meal delivery services, again, for those that might be experiencing transportation or mobility issues. The YMCA in your community may offer a lot of free or reduced price classes or events that may be good to learn more about. And finally, Parks and Rec departments would be a great kind of entity to engage as well in regards to building more parks in certain areas that may not have safe places to exercise, and other community events just to kind of create more community relationship building as well. And then finally with housing, obviously the housing agencies, the shelters in your community, and so many more partners in the housing agency to consider for your community. So the next step in forming a community partnership is forming that connection. So there are a couple ways that you can do this, and again, this is not an exhaustive list. So one is just simply attending an organizational meeting to initially form that connection. So again, like your local transportation authorities, your local chambers of commerce, you know, a lot of these community-based organizations have community meetings or town hall meetings, and so you're always welcome to join those just to learn a little bit more about what they do. You might be able to have your voice heard or raise some concerns or needs that you've been hearing, because you guys are a witness as to what happens when socioeconomic needs are not addressed. And so you guys are really at a pivotal point where you can kind of show that data and then relay those stories and kind of create that need of being able to work together to address these social determinants. So the map that I have on there was kind of, I kind of alluded to this example earlier, but again, being able to kind of highlight those needs. So this map is showing the transit need, where the dark green is the highest need and then the white is the lowest need. And so that's just a really helpful way to display data to then show to the transportation authority about, where there are those areas that could really benefit from more options of transportation. Another way you can form a connection is, inviting the community partner to your organization so that they can learn more about what you do, who you serve, and the same goes with you guys. You should also make an effort to go to their organization to learn more about what they do. And by kind of doing site visits with each other, this can really help identify your strengths and opportunities for collaboration and partnership. And visiting can also help identify areas that need investment and resources, which is really important to know on the front end, because that will really help you figure out what kind of partnership and what kinds of goals will be feasible for the both of you. Because if you're both have gaps in certain areas, you then might need to think about applying for funding to build capacity in those gaps, or you do a workaround so that, again, you highlight your strengths and work around your gaps. The next thing you'll want to do is to clarify a common agenda and then identify clear partnership objectives. So with this, in some cases, your goals will easily be the same. As we talked about before, that if you're both serving the same population, then likely you will have similar goals in terms of improving the health and the well-being of that particular population. But in other instances, you guys may have very different goals, and so it's important when you're establishing a partnership between each other that you really come to terms on what similar goals that you both have that you can then work around. So a logic model may be a good way to help identify those common goals for guiding your work, and that can lead to a stronger plan. So in a logic model, you're kind of thinking of what are those things you ultimately want to have an impact on, or what are those outcomes that you hope to have, and then what is it really going to take to help you get there. And so by working through this kind of work plan or a logic model, you may identify that, oh, in order to make this work, we're going to need to have these particular staff involved in this project, or in order for this to work, we're really going to have to develop some key educational resources or classes for patients or something. So going through this process, I think, will really just help identify some of those key facilitators for success. It's also important at the beginning to kind of discuss how you both will support the partnership. And again, there might be lots of things that you can do with your current funding, or kind of things that add value to work you're already doing. But in other cases, you may need to apply for other funding or seek other funding. So that's something that, again, you guys should kind of discuss on the onset and figure out strategies that what might be feasible for you guys. I think something very important to think about is just give yourself the flexibility and the ease of just taking your time and starting small if needed. The fact that you're even thinking and starting on this journey is amazing. So don't be wary about just starting small, because the important thing is that you're getting started, and that's what's most important. So starting small can be just simply sharing informational resources with each other about, services that you each have and provide to your populations. And that way you can kind of set up those referral networks. That's a great way to get started. And then once you learn more and you take time to learn more about each other, and then you could potentially come up with a more concrete project goal or something that you can both then work on. And finally, as with any partnership, just constant and clear communication is key. All of your organizations and partners will be contributing something very meaningful to this initiative, and so just trusting and respecting that is really important. And the next couple things that you'll want to do is kind of secure that partner commitment and develop a strategic action plan. And this is not meant to sound scary, because again, partnerships can simply just be setting up referral systems between each other. So this is not meant to sound daunting, but we found it really helpful that it's really kind of important to have either a memorandum of understanding or a partnership agreement, just so you guys are clear on roles and responsibilities and your common goals, and something that kind of is a little bit more binding than a simple verbal agreement on what you each will contribute and how you will work together. We have some sample memorandums of understanding between kind of health organizations and then community-based organizations. They are part of our Prepare, Implementation, and Action Toolkit in Chapter 8, which you can find at nac.org/prepare. And then, again, when I say strategic action plan, again, that's not meant to sound scary. Again, this can simply be your logic model, which I've kind of had the components of a logic model on the screen here, where you're figuring out what is ultimately the impact you want to have, what will those outcomes be, and then what kind of needs to happen in order to achieve those outcomes and that impact. And then finally, you want to maintain your relationship and then evaluate your work together. It's really important to evaluate what worked well, what didn't work well, was it effective, was it relevant, and those kinds of things. So in order to maintain your relationship, kind of really stick to your logic model and revisit it often just to make sure, are the goals still the same? Have the goals changed? Have you achieved your goals and now you want to move on to a new set of goals? So it's just something to keep revisiting that logic model because that will help you on your stay on your path. And then finally, in regards to evaluation, this is a great opportunity to bring in your local educational academic institutions. So there are lots of students that will be looking for capstone projects, independent studies, theses, lots of things. So this is a great opportunity to potentially have a student involved, or if you want some professors involved. But just something to keep in mind that when you're working with academic institutions that you ensure, again, just as with any partnership, that your goals are the same. And then it's also important that you guys as the community organizations, whether it's a community healthcare organization or a community social service organization, that you guys are valued as partners in this, and that you guys have been working with your community to do the work. So as a result, like, you guys should be authors of anything that's published. You guys should be sure to share the results back with your community partners and your patients for kind of to see if the findings resonate with them. They may help you to be able to interpret some of the results and validate the results. When working with academics, like, this is also a great way to educate them. So have meetings at your respective organizations so, again, they can learn more about what you do and your mission and meet patients potentially. And then be sure that you're kind of discussing next steps and priorities as a group. So again, what worked well, what could be improved for the future. And just some things to consider as you're thinking about community partnerships is, again, we kind of talked about this earlier, but do you have the capability of sharing data with community partners? So kind of in a more low-tech way to do this is by having a data sharing agreement in place. And again, we have sample data sharing agreements also as part of Chapter 8 of our Prepare, Implementation, Action Toolkit. Feel free to check it out on our website. But if you want a potentially more advanced way of sharing data, potentially electronically or actual kind of database systems, there are some tools that you can consider to help facilitate data exchange between an electronic health record and then non-EHR database systems. So there are a couple listed on here, and again, this is definitely not an exhaustive list. But Empower is a tool that is used by a lot of community action agencies, but this is something that could potentially sit on top of both the electronic health record and the database used by the community action agency or potentially other community-based organization, and allow the data to potentially talk with each other. So something to look into. The digital bridge is something else to consider. But other things is that your state may be using something to help facilitate data exchange amongst clinical and non-clinical organizations. So you definitely want to look into what might be used at your state already, because if you have a health information exchange, if you have a community information exchange, whether you're a part of that or not, you still may want to look into how they are sharing data amongst those organizations, because if you're not already involved, there may be an opportunity to become involved later on that you don't necessarily want to use a different system than what already might be used in your state. Same with just other state-based tools, like Michigan is using Care Connect 360 to be able to kind of share data across different types of community providers as well. So definitely worth looking into what might be used in your state before going to a different tool entirely. And I wanted to provide some examples of ways to kind of integrate non-clinical care and services into a clinical setting. So we kind of talked about ways to build those partnerships, and I kind of wanted to leave you guys with some examples of things that you can do both in-house in your organization already. And again, I hope that you find that some of these don't seem like heavy lifts, but could have a big impact. But then other things to think about that you could do with community partners as well. So in regards to ways to address education and employment needs, things that you can do in-house, first and foremost is that once you learn of patients' education level or their literacy level, you can make sure that your providers and your staff are really kind of discussing prescription instructions and treatment plans in ways that really kind of match that patient's literacy level and ensure the patient really understands the plan as it's being explained to them. Something that a lot of organizations do is have kind of a free book exchange that in the waiting room, or if you have like a little children's area, you know, you can have books that people can take and bring back or deposit another book as a way to just kind of help facilitate access to books. You could have a clothing drive to collect professional clothes for patients for their job interviews or, you know, be able to use with a new job that they get. So that's something that your organization could easily kind of do as a community way to bring a needed resource to those in need. Or you can offer some after-school or summer programs as well. And then through partnerships, obviously you can refer patients to employment centers for assistance with resume building and interview practice. We kind of talked about this before with temp agencies for work opportunities, partnering with the community colleges to offer classes on those key life-building skills such as computer skills, financial literacy, job training, but something to keep in mind that if you're referring them to actual classes, it may be worth looking into financial aid options, or potentially is it more around engaging teachers or professors at the community college and inviting them to the health center or your organization to be able to do some ad hoc classes themselves. We talked about Head Start, but something else that you could think about doing as a community is organizing a career or job fair that's featuring kind of local and community serving businesses to kind of highlight opportunities for people in your area. And then finally, we talked about this as well, encouraging that business development and local chamber of commerce to hire locally as well. So some ways to address food and physical activity needs, things that you can do in-house. Obviously, you can have a food pantry or food donation drives. That's something that you can maintain throughout the year and be able to provide to your patients immediately as soon as they identify a need. You know, how great could it be that, you know, as soon as they identify a need, they leave with a box of food from their visit. You could build community gardens in your lots or on your roof if you have the capability, and then kitchens to be able to offer nutrition classes or cooking classes. And that's a great way to get people involved as well as kind of like a stress-reducing activity if they're able to take a part in the community garden. You can build walking paths around your organization, either indoor or outdoor, just to be able to facilitate some of that opportunities for exercise. We've actually heard recently about some health centers that do walk and talk, where as opposed to kind of sitting with the patient and doing various health assessments, they walk with the patient and talk about the health assessments with the patient as they're walking. So again, that's another way to potentially encourage more physical activity within a visit. Obviously, helping with patients with eligibility assistance for various programs, whether it's WIC or SNAP, that's definitely something you can do in-house. and a great way to potentially provide a great resource for patients as well. We've also heard of some that have WIC or SNAP representatives on location as well to be able to do some of that eligibility assistance as well. We kind of talked about this, but offering grocery shopping classes and tips, being able to shop healthy on a budget, and then finally is providing a list of nearby parks or trails that would be easily accessible to people either in their community or near your organization as well. And then with partnerships, with your local schools, your parent-teacher associations might be really powerful organizations to consider working with to be able to advocate for either healthier options within the schools for kids or free or reduced breakfast and lunch options for kids, both during school and throughout the summer as well. Similarly, if you guys have a community garden or cooking classes, you can also work with schools to establish those there as well. We talked about this, having farmers markets kind of coincide with your organization so that people can kind of get not only their medical care, but then also have some great fruit and veggies to be able to go home with as well. This has been written up a lot, but there are lots of those kind of quote-unquote fruit and veggie prescription programs where a provider can prescribe a certain amount of money for patients to then use for fruits and vegetables at the farmers markets that can go hand in hand with their WIC and SNAP benefits, and so that's a great way to kind of increase the value of those benefits as well. And then you can partner with food banks or food delivery services to have food delivered to those that are experiencing transportation or mobility issues. So ways to address transportation needs. One thing you can do in-house is that simply when scheduling a patient, definitely talk to the patient to see how much time that they would be able to spend at a visit, but if you're able to incorporate several things into one visit that may be really convenient for them if they experience transportation issues. So having their medical, their dental, their pharmacy kind of all in one visit or one place, that way they don't have to come back multiple times to get their prescription or whatnot. So something to consider for that. Something else is just having a health fair periodically that would provide multiple services and kind of a one-stop shop for patients as well. And that way, if patients are, if it's promoted and patients know when it is, then they know and can plan to come for this one-stop shop and get a lot of their needs met in one go. We mentioned this: provide bus tokens and taxi vouchers for patients. But mobile clinics can also be a great way. And again, once you have data to kind of figure out those areas that are really experiencing transportation needs, you can take your mobile clinic to those areas and have kind of a quote-unquote health neighborhood day. So again, if you advertise and market it in the neighborhood and they know that you're going to be there on a certain day, it's a great way to kind of really engage the community, provide some needed services to areas that really might not be able to access them otherwise. So something else to think about doing. There's home visitation programs, obviously, and something else that this isn't necessarily addressing, but kind of more of that long term is calculating that the revenue lost, the money lost due to missed appointments that are due to transportation needs, and then you could potentially figure out a return on investment based on kind of money that could be generated if you fix this transportation issue, and so as a result, X% of those patients would be able to come in for their visit and not miss an appointment. And then some things you could do through partnerships, again, Uber and Lyft, ride-sharing programs we've talked about. Community carpools are becoming an increasingly more popular thing where it's either run by a community or an individual, but they have a van or a bus that kind of takes patients to major community organizations, whether it's like the health center or the library, the grocery store, the YMCA, the bank, and kind of do this route for a set period of time, and it's kind of advertising so people can hop on and hop off as a way to kind of get around. We've talked about advocating for new routes based on geomap data. And another thing that you guys can do as a community is advocating for needs-based pricing for students or for seniors, for low-income individuals, for veterans. So that's something else you guys could think about doing as well. And then finally, some ways to enhance community development and interaction are in-house if you want to start offering some classes, so whether cooking classes or Zumba, yoga, art classes, meditation, wellness classes. You can organize cultural family fairs to stimulate engagement and interaction in the community, or you can organize community donation days to collect shampoo or toothpaste, pillows, blankets, anything that you know might be needed in your community, but as a way for the community to kind of rally behind and get involved together. Some of these pictures that are on the slide is on the bottom. This is a health center where the wooden parts that are steps, but they also serve as seating for a stage. And so the health center actually kind of operates also as like a local community theater. I think theater is a little bit of a stretch, but kind of community arts station as well, where oftentimes, you know, kids or schools kind of can do some of their performances there, and so that's a great way to kind of integrate with the community as well. And then on the right, a community has organized like a market where goods that are developed by community members are kind of sold at this market, and it's also kind of a cultural exchange as well. So just some ideas of things to do. And then finally, through partnership, you can organize a neighborhood cleanup or beautification days to clean parks or beaches, or to pick up trash or paint over graffiti or something, as something you guys can do together as a community, or partnering with, you know, Habitat for Humanity or other similar organizations to help kind of revitalize certain areas that are in need of housing or whatnot. Lots of things you can do together as well. The big question on the table is, you know, this all sounds wonderful, but how do we really kind of, you know, sustain this kind of work? So I wanted to provide you with some opportunities that you might be able to potentially leverage to be able to sustain some of this clinical and non-clinical work. So for those of you that are in states and participating in alternative payment methodologies, that obviously provides a little more flexibility to be able to do some of this non-clinical work and outreach and whatnot, so that's definitely something to keep in mind. Many other states are starting to participate in health home initiatives, in which case things that like community health workers are often involved in health home initiatives, but like comprehensive care management, care coordination, referral to community and social support services, those are all considered service, like billable services under health home, and so that's an opportunity that if your state and your organization is participating in health homes, something that you can leverage. Again, local, state, and private funders. So oftentimes, like most any private larger corporations, so your grocery store chains, those kinds of things, they often have a foundation arm that are interested in various topics, but a lot like, so for example, if it's a large grocery store chain, they likely have a foundation opportunity to improve nutrition or improve fruit and veggie consumption or improve outcomes. So those are things to consider looking into. And again, we talked about certain state funders as well, that more and more funders are really paying attention to social determinants of health, and they know that it's going to be hard to move the dial on health outcomes without addressing the non-clinical factors as well. And so I think more and more funders are becoming interested in social determinants work. So from HUD, the Department of Housing and Urban Development, there are some various housing funding opportunities. One of them is Continuum of Care. Another is the Emergency Solutions Grant. So those are things to potentially look into as well. Certain states also have homeless trust funds that's an opportunity to potentially look into as well for housing. And then there's also some other funding for specific social determinant work as well, whether it's community food projects, or food insecurity nutrition initiative. Those are some things to look into to focus on certain social determinants. So again, while it's not necessarily a complete sustained funding stream, this is where we really are striving towards. So just as important as collecting standardized data on social determinant risks is important, it's also hugely important that we start really having a standardized way of documenting what you guys are doing to address the risks. And so we really hope to be able to have both sides of this coin, if you will, or both sides of this equation to really kind of make the case demonstrating the value of non-clinical services, social determinant interventions, and community partnerships, and then use that data to really kind of help inform those more sustainable funding models to do this kind of work. So I did want to kind of, I'm going to jump ahead just giving time. Our national PREPARE partner, so AAPCHO, the Association of Asian Pacific Community Health Organizations, has a standardized coding list for non-clinical enabling services that you see here on the screen. So there are various enabling services, if you will, and then codes associated with them, and then the minutes, so the amount of time that your staff spent delivering that service. So it's not just about documenting the service that was provided, but also the intensity of the service that was provided. Because in some cases it may be provided for 10 minutes, but in other cases it may be provided for 60 minutes. And so you want to take into account just what it takes to care for a complex patient. So here is the list of enabling services and their codes. AAPCHO has been working with some of the health center controlled networks and other vendors to be able to build this also into the electronic health record. So what you see on the screen is a template for GE centricity, which was developed by the Alliance of Chicago. So this is the PREPARE template that you see on the screen right now. But if you look in the bottom right corner where it has the purple and the red circles, you'll see kind of there that there's an enabling services template. And so here, sorry, it's blurry and it's small, but here is kind of what the enabling services template in GE centricity looks like. So again, it has each of the enabling services and then the time intensity. So it goes from 10 minutes up to 2 hours, so 120 minutes. And so you can easily kind of deduct or deduce kind of how much time was spent providing that service, and you can click as many services as were provided and be able to add that to the patient chart. Just so you know, there are lots of these resources available at our website, so feel free to take a look. We have a whole chapter on enabling services and being able to track those. That's chapter 10 in our implementation and action toolkit. But with that, I know we're very close to time. I apologize about that. I will look to see if there are a couple questions I can answer quickly. But if you would like to learn more or be updated on the latest kind of resources or other learning opportunities, feel free to email me to join our listserv, and we would be happy to include you. But with that, I'm going to take a look at questions real quick. Going through. Yes, I see the slides. I will share the slides with everyone that attended, so that is not a problem. We will be posting the recording on our website as well. Well, for those that need to jump off, I do want to be respectful of time. So again, I apologize that we went up to the hour, but we will try to respond to all the questions that were submitted to the best of our ability via email as well. So, but thank you guys for attending, and please let us know if you would like to join our listserv. But thank you guys.